Ireland has the worst trans healthcare in Europe. So we're calling for, a complete kind of overthrow of the National Gender Service in favour of, GP-led, informed consent-based kind of trans healthcare, for across Ireland. And we call for that because, with trans healthcare in Ireland, it's, up to a decade-long waiting list. When you're there, you're asked really invasive personal questions, around kind of your sexuality, your like porn habits, and around kind of detailing like really, horrific abuse and trauma that you may have gone through. Questions even like cis people would not really want to answer in front of a doctor that they barely know. And the fact that, a lot of the times you can be denied healthcare and trans healthcare for a number of reasons. Because you're autistic, because, you're on social welfare, maybe you're not out to everyone, like your family, or, you don't fit into this, like, perfect kind of box of what, the National Gender Service sees as, like, a real trans person. So we're calling for a much better trans healthcare system that, gives trans people the information that they need to make an informed decision and actually empowering them to make decisions about their bodies, themselves and their transition goals themselves, without kind of having to fit neatly into this kind of box of what, a true trans person is.
Jenny, are we getting any better? Because I suppose education is the key, where historically we had Pride recently enough, and that was more of a celebration than a protest. But as Paul said, this really is about awareness and protest, because a lot of people actually, and I think just through ignorance and not through malice, don't understand. Is it getting any better?
Absolutely. I really wish I could say it's getting better, but we would say it isn't. I mean, just to jump off what Ollie was saying, like, the current situation with trans healthcare, with gender recognition, has stalled. We are at a place where trans people are once again up for debate. It's become so normalised that, in workplaces across Ireland, trans people, suddenly their identity is under question, under scrutiny, which just stops them from living in safety and security. I mean, only recently, trans feminine people like myself, we are now denied the right to get a breast augmentation with the current schemes in the HSE, whereas trans masc people can, to get a top surgery. The waiting list is 10 years long. The different places across the country that previously offered private care are being told to roll it back and to stop. And so we just feel like, even just on the streets.
Ollie, you said there about it would make things easier for a GP-led. So for your own GP, who knows you, who's grown up with you, this would make more sense as a process rather than somebody who, like you said, is asking invasive questions, who doesn't know you. So that would be an ideal dream. Yeah,
but also the fact that, GPs are already kind of prescribing, HRT, hormone replacement therapy to cis people. I mean, cis women go through menopause, they're prescribed, HRT, the same kind that, is prescribed to trans women. If a cis man has low testosterone, he goes to his GP and he gets prescribed testosterone. So it's not even like a new thing that would have to be kind of, implemented. It's something that GPs are already trained to do. It's just the fact that GPs are, being told by the National Gender Service that they can't prescribe HRT to trans people. And also if a trans person is maybe self-medding or is getting, hormones from, the grey market, which is something that
has happened
many trans people have to do. They're told, the National Gender Service is telling GPs, like, don't treat these patients, don't give them blood tests that they may need, like, medically need to,
For harm reduction.
for harm reduction, and they're being told by the NGS like, don't do this. So it's not a problem of GPs not wanting to do this. It's the fact that the National Gender Service is blocking them from providing care.
It's kind of othered it. It's like instead of your primary carer knowing you since you were small or whatever, and they can recognise, well, obviously no shock to me that this person is trans, and then they act appropriately like any other healthcare. But I was just thinking earlier on, I remember covering a court case years ago, Dr. Lydia Foy, when she was campaigning to get her passport changed from male to female. And I mean, the eyes of the world were almost on it, and she was ultimately successful. But I thought that would have been the start of a completely open discussion and Irish people opening their minds, but we can see now that the aggression towards the trans community and the intersex community is actually getting worse.
Absolutely.
Do you feel safe?
Do I feel safe?
Do you feel safe?
we have posters around town that we put up, and they've been ripped down. We have had stickers put over our posters with horrific statements trying to villainise and demonise trans people who are just trying to live their lives. Like,
what are people afraid of?
I know.
It seems fear.
Yeah, I think it's also not only fear, but it's very much an aggression of wanting to keep the status quo, wanting to keep that idea of a nuclear family, and that this is what women are, this is what men are, and they're completely separate. And that, it helps, the capitalist system to have those kinds of gender roles so enforced and so violently enforced, because, it justifies, rolling back on abortion rights. It justifies, not paying women, the domestic work that they do often in the homes, the work that they do towards the elderly and the children. We've seen it even in the pandemic, nurses not being paid a livable wage. And it's, it's no coincidence that this is, a very woman-led kind of workforce. And so you need those violent kind of, you need violence towards kind of trans people, people who don't conform to the gender binary, in order to justify, the wheels kind of turning this kind of workforce.
And today is about eradicating that. Today is about having that protest and having that message.